Good afternoon, everybody, and welcome. We'll go ahead and get started as other people join. We'll just let them dive in where we're at. So welcome. My name is Terry Hecker. I'm Wellness and Benefits for the Medical College. And also with us today, we have Celeste Miller and Mark Lash, who are part of our retirement team. And then our facilitator today is Mark Wildeman, and Mark is from Waddell and Reed. He's a financial advisor, and he may look familiar. He's done some other sessions for us, which have been wonderful, and we're going to hand it over to him in just a minute. We're getting a few more people joining, and the numbers are keep ticking up here. Today's session is on Medicare. Typically we've done this retirement series and we cover a lot of different topics. So today will be Medicare, and we're going to ask you to put your questions in the Q&A because you all are muted upon entry. So if you could put your questions in the Q&A, and we will take questions out of there periodically if we have them, but definitely at the end of the session, we'll make sure I can get to all of your questions that you have. So I'm going to turn it over to Mark and let him get started here. So Mark, you should be able to share your screen now. Hopefully you've got the ball here. Perfect.
Okay, that looks good.
Yes, it does.
Okay, perfect. And I need to set up one other thing here. And so I think that I am good to go. So good afternoon, everybody. And it's a pleasure to be with you again. And I'd love to do this in person with you, but obviously we are still in a situation where it's better to be safe and to do this virtually. But I've always enjoyed coming out to the medical college and being together with you and to cover some important topics that are essential for your retirement as well. So again, my name is Mark Wildeman. I am a financial advisor with Waddell and Reed, and this is a very important topic. I've been speaking on Medicare for a number of years now, and it's a topic that is not getting any less complicated and certainly just more challenging for people to make these decisions. And yet it not only affects your retirement financial future, but it certainly also affects your healthcare as well, and the type of healthcare that you're going to be eligible to receive throughout those retirement years. So we are going to talk through this, and as Terry mentioned, you can send along questions. I'll try to pause a couple of times during the presentation and go through some of the questions, although this is a pretty large group, so maybe we're going to have a lot of questions and I might not be able to get to all of them, but we'll do the best that we can. So with a topic like Medicare, one of the challenges is we can't really cover everything that you're going to need to know, but my goal is to give you some of the real broad concepts about Medicare that are important to make sure that you have some direction moving forward. I am going to mention that at the end of the presentation, like I've done for all the presentations, whether it's the medical college or I do a number of seminars across the area, I do invite you to take me up on the offer to have an individual consultation, because this is a topic that is different for everybody based on your needs, your financial situation, your health situation, and so on. And so at the end, I will be inviting you to take advantage of a meeting with me where I can even give you some more individual specific information, and we'll talk more about how to make that happen and what a conversation might look like along those lines. So let's jump into it and get going here. So first of all, what is Medicare? Medicare is I got to organize my screen a little bit more here. Here we go. Okay, so Medicare is a national health insurance program. As you know, it's for people over the age of 65, and it's administered by the Centers for Medicare and Medicaid Services, although enrollment is done through the Social Security Administration, which is real convenient because if you're turning on your Social Security benefit, you can handle Medicare at the same time. Who is eligible for Medicare? Anybody over the age of 65 for US citizens, but also legal residents who have lived in the United States continuously for at least 5 years. There are those under the age of 65 that are eligible for Medicare as well if they are on Social Security disability benefits, and then that becomes available. As many people know, there are 4 parts to Medicare, and this has evolved over time. So let's talk about those in general. First of all, Part A covers your hospitalization. So if you need to go to the hospital, then Medicare Part A is what you would be using to cover that event. And the great thing about Part A is that it is free. There is no premium with Part A. Then Part B came along, and Part B covers the costs of medical services such as regular doctor visits. So your regular checkup is going to be a part of Part B. Other procedures and diagnostic tests would be a part of Part B. And the thing is all the bills for Parts A and B are paid by Medicare or directly from Medicare itself. Now, then things become a little bit more complicated because Part C is Medicare Advantage, which is an alternative to regular Medicare. We're going to get into that. And then Part D is really where your prescription drug benefit comes in. Now, Part C and Part D, you do not acquire those through the Medicare system. You would actually get them through private insurance companies, and we're going to talk quite a bit more about that. But again, Part D is an option that you can exercise in order to get prescription drug coverage, but it is all still through the overall Medicare system. So, one of the first things that you need to decide as you enroll in Medicare is to decide whether you're going to go with an original Medicare setup or whether you're going to go with Medicare Advantage. So let's start with original Medicare. Original Medicare is made up utilizing Part A, which again is your hospitalization, and the premiums for Part A are free. Part B then, this is optional, but many people do exercise Part B as well in order to have healthcare coverage for your regular doctor visits. This year, Medicare Part B does cost $148.50 per month per person in order to have that coverage, and that is Medicare Part B. You can go further and get Part D as well. The average cost for Part D for the prescription drug benefit is about $40 per month per person. And again, Part D, though, you would not pay for that from your Social Security check. You would be paying for Part D separate because you would be getting Part D through a private insurance company that is then subsidized by the Medicare system, but you're still getting Part D through a private insurance company. If you have Part A, Part B, and Part D, you've got pretty good insurance coverage, although there's a lot of, we use the word gaps. There's various deductibles, there's gaps in coverage, and various things that you might have to pay for if you only have Part A, Part B, and Part D. And so that is where on the bottom here, Medigap coverage comes in, but that's also commonly known as a Medicare supplement policy. So the Medicare supplement policy again comes through a private insurer, but it is regulated by the Medicare system and subsidized by the Medicare system. But the supplemental policy is designed to cover all of the things that may not be picked up between Part A, Part B, and Part D. I tell my clients all the time that if you have Part A, Part B, Part D, and a Medicare supplement policy, you may have, even though the medical college has very good health coverage, between those 4 parts, you might have better coverage than you've had before, because that's a pretty comprehensive strategy if you go with an original Medicare. To review the premium costs again, Part A is free. Part B is $148.50 per person per month right now. So double that if you're looking at coverage for a married couple. I will say as well that that premium is going up at about a 6% rate per year, give or take. So it's getting more and more expensive. Part D on average is about $40 per month. And what I see with my clients on average is the average premium for the supplemental policy is right around $130 to $150 per month per person. So if you add all that up, that puts you in the $330 range as far as your coverage goes in the Medicare system. But again, once you're paying for all of those things, you have a pretty comprehensive healthcare strategy going. Now, let's move over to Medicare Advantage. Medicare Advantage has gained a lot of popularity recently. In fact, probably about a third of people in retirement are on Medicare Advantage now compared to original Medicare. So what does this involve? Well, you still have Part A, which again is free. You still have Part B, which you'd be paying for at $148.50 a month. But instead of going with a separate Part D and or a supplemental policy, you would get a Medicare Advantage policy, which covers Part D and a supplemental policy, but it's really boxed into an all-encompassing Medicare Advantage type plan, again, bought through a private insurance company. But instead of paying $40 here for prescription drug coverage, and instead of paying $130 to $150 over here for a supplemental policy, the Medicare Advantage policy, which would replace that, is on average about $27 a month as I work with my clients on that. So why is it that much cheaper when essentially you're still, as part of the Medicare Advantage policy, getting Part D prescription drug coverage and a variation of the supplemental policy? Well, the Medicare Advantage, there's two issues there. Number one is it might not be as comprehensive as everything here on the left side. So you're going to get nickel and dimed a little bit. When you go into the doctor for your regular checkup, you might be paying a copay of $10, $25, depending on what you're doing at the doctor. So you're going to pay a little bit more in out-of-pocket costs for the Medicare Advantage plan. So that's one thing. The other thing is the Medicare Advantage plan works best if you can stay within one healthcare provider. So you would buy the policy for the provider that you're active in, whether that's Pro Health or all of the different options out there. And so it's best if you're staying inside of that provider's network, and then you buy a Medicare Advantage plan that is specific to that network. So it takes some research and takes some shopping there. But ultimately, instead of paying the $40 over here for Part D and let's say $140 over here, so that's $180 in premium. The Medicare Advantage policy is probably less than 30 bucks a month, and that's where you can save some money if it's right for you. And I tell people, if you're going to the doctor quite a bit, original Medicare is probably still the better way to go, as opposed to getting nickel and dimed a lot on Medicare Advantage. But I also work with a number of people who don't go to the doctor all that much, in which case Medicare Advantage might be a really good way to go. Okay, let's talk about enrollment, because enrollment itself is one of the most important things that we're going to discuss. Now, enrollment comes down to splitting you into one of two categories. And that category is defined by whether you are covered by an employer group plan that covers 20 more or more employees. So let me back up though. Prior to age 65, you don't have to worry much about this. But as I've worked with several people at the medical college, many of you work past the age of 65. And so this pertains to you because what should you do once you turn 65? And even though you might plan on working until age 70, what should you be doing here? Well, so if you're working at the medical college, obviously the medical college is a big employer. So you work for an employer that has more than 20 employees that are active within your plan. So for you as an individual, you do not have to enroll in Medicare once you're 65 because you fall into the category of working for an employer that has 20 or more employees. Now, that's true for you. That's also true for your spouse, where they are eligible to stay on your plan after the age of 65. There's a however, and maybe many of you know this, that in order to keep your spouse on the plan, even though they're 65 or older, you do not necessarily have to have that spouse enroll in Medicare, but because they are eligible for Medicare, then there is an additional $75 a month within your medical college plan to keep that spouse on your plan. So then the question is it better for them, that spouse, to go on Medicare, or is it better for them to stay within your plan? And that's an individual issue for you and your situation and something to talk through. But you're going to see this a number of times in this presentation is whether you're covered in an employer group plan that covers 20 or more employees, because that makes it unique for you then and whether you should be on Medicare at age 65 or not. Now, this is a very important issue because what happens if you don't enroll in Medicare on time? If you're working past the age of 65 at the medical college, this doesn't necessarily apply to you. And we'll get into what you should do as your time at the medical college is done. But in case you're wondering, for individuals who didn't enroll in Medicare at age 65 because they're not covered under another plan or they're not covered under a plan with less than 20 employees, there are three problems here. Number one is you might have to pay late enrollment penalties. And this is not only a one-time deal. The late enrollment penalties are steep, and they not only affect you for your first year on Medicare, they affect you for the rest of your life. You do not want to be subject to late enrollment penalties. Also, your healthcare expenses may not be covered by insurance. You might actually start to lose coverage if you did not apply for Medicare on time. And then finally, your private insurance options, which are buying Part D, your prescription drug benefit, or your supplemental policy, or if you choose instead to go with Medicare Advantage. Those are all plans that are bought through private insurance companies. They have to accept you if you apply for Medicare on time. But if you apply late, then some of the options that they would be mandated to offer you, they may not have to offer you that as well. And that can be huge. Bottom line is make sure you apply for Medicare on time because the consequences are huge. Okay. So then the question is how do you enroll in Medicare? If you're receiving Social Security when you turn age 65, you will automatically be enrolled in Parts A and Parts B. They'll just automatically put you in there. You can opt out of Part B, but automatically they'll put you in there if you're drawing a Social Security check at that point. If you're working and covered by an employer group plan, you may not want Part B, and that does apply to you or your spouse that we just talked about that maybe doesn't work at the medical college, but if they're over the age of 65, they might not necessarily want to be in Part B. They might want to stay on your plan. In that case, you can decline it, Otherwise, you'll go ahead and accept Medicare Parts A and Parts B, and your coverage will start on the first day of the month that you turn age 65. Now, Part C and Part D, Part C, which is Medicare Advantage, and Part D, which is your prescription drug plan, those are not automatic, and you do not sign up for those through Social Security or any government agency. I've said a number of times that you buy those through a private insurance company. And so that's important to know, and it's important to shop that to make sure that you find the plan that's right for you. Okay. Now, what if you are not receiving Social Security when you turn 65? You've decided to delay your Social Security to be later. And so more and more people are continuing to work or at least delay the start of Social Security in order to receive a higher benefit, but they might want to be on Medicare. So in this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period, which we'll talk about on the next slide. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you are covered by an employer group plan because you or your spouse are still working, you have what's called a special enrollment period, and that's going to apply to many of you, and we'll get into that on the next slide as well. If you miss either one of the initial enrollment period or the special enrollment period, you can sign up for Medicare during the general enrollment period. That's not the place that you want to be, but that's your last chance to sign up for Medicare then. Okay. So this is the initial enrollment period. That's for people who aren't covered by a group plan at age 65. And so for the 3 months prior to your turning age 65, you can sign up for Medicare. This is, if you're signing up at age 65, this is where you want to be. You want to sign up for Medicare the 3 months before age 65, because then you won't have any problems there. Okay. Now, if you don't sign up by age 65, that doesn't automatically mean you face the penalty. You just fall into the delayed start period, which is the 3 months after you turn age 65. It's still okay that you're signing up within that period with one minor consequence, and that's listed at the bottom here. If you wait until the last 4 months of your initial enrollment period to sign up for Part B, your start date for coverage will be delayed. It's just really delayed until the following month. You might have a slight gap of coverage in there. Hopefully that's not a big deal at all, but heaven forbid you sign up in this delayed start, let's say on the 10th of that month, you may not be covered until the first of the following month. And let's hope something catastrophic doesn't happen to you within that period of time. So this is the initial enrollment period. And so you sign up for this if you are signing up for Medicare at age 65. For those of you that might not be retiring at age 65 and you're still working at the medical college and want their coverage after age 65, this does not apply to you. You would not actually sign up in the initial enrollment period. We'll get to that yet. So who signs up for Part A during the initial enrollment period? Almost everybody who turns 65, except for people still working and they're covered by an employer that has 20 or more employees within their group plan. Okay, let's move on here. And so the key with Part A, though, is because that's your hospitalization, it's still not a bad, in fact, I would strongly encourage you, if you're at the medical college or working past the age of 65, still contact Medicare, because you can sign up for Part A. There's no reason not to. And then you can tell them that you are opting out of Plan B at that point, or Part B, because you're staying on your employer's plan. And so it's a good idea to communicate to them as well. So who signs up for Part D during the initial enrollment period? Again, people who are not covered by a comprehensive employer plan, even if they're working. So if you're not working, you want to sign up for Part B for sure in the initial enrollment period surrounding your age 65. If you're self-employed, if you're employed by a company with less than 20 employees, or if you're on COBRA, meaning you left your employer plan, but you're buying into the coverage from your previous employer for the 18 months that they are required to offer it to you. If you are in a situation where you're receiving retiree health benefits from an employer, then you may not necessarily be signing up for this, but they might require it, but that's another topic. Employed by a company whose health plan is less comprehensive than Medicare. So some people that are working past 65 might still be eligible for employer plans, but many of them move over to Medicare because of the coverage and because of the cost and so on. Who signs up for Part D? Again, this is getting pretty redundant. If you're working past age 65 at the medical college, you probably wouldn't sign up for Part D because you have prescription drug coverage through your plan itself. But for people who are on Medicare Parts A and Part B who aren't working past the age of 65, then you definitely want to sign up for Part D at that point. So all depends on whether you're working at the medical college past age 65 or not, as far as when you should be signing up for this. Now, if you're working at the medical college past the age of 65, then this initial enrollment period really does not apply to you, but the special enrollment period does. So the special enrollment period is for people maybe in your situation. Let's say you work until age 70, you keep your coverage at the medical college, but then at age 70, you're retiring. So as you retire, the special enrollment period does apply to you, because then this is now going to become your healthcare provider once you retire from the medical college. Bottom line, though, is before your termination date, this is all you need to know. Before your termination date at the medical college, sign up for Medicare ahead of time. So really, as your coverage ends at the medical college, the special enrollment period is the 8-month period starting the month that your group coverage ends. So the 8 months prior to your termination at the medical college, you should be signing up for Medicare. And again, that's whether it's original Medicare or Medicare Advantage. Also for Part D, the prescription drug benefit, you should really sign up again prior to your termination. You still have 63 days after your coverage ends. Just do it before your termination date, and then you don't have any problems. Okay, so to recap those two, the best time to enroll in Medicare is, in order to avoid late enrollment penalties, sign up during the initial enrollment period. That's for people turning age 65 that need to go on Medicare. Or for a lot of you, it's the special enrollment period that you'd be signing up as your coverage terminates with your employment termination. To avoid gaps in coverage, sign up before your current coverage ends, and then you won't have any problems. If you do have problems and you don't sign up when you really need to, then the general enrollment period is what applies to you, and you do not want to be here, because if you're here, that means you didn't sign up on time. And so you've got a number of problems. Number one, your Medicare is going to be significantly more expensive, and we're not going to go into how that fine gets calculated. All I'm going to say is that it's substantial and that it's going to last you the rest of your life. So that's one thing. And then you might have coverage problems as well. The other thing about this is as you sign up in the general enrollment period, you only have 3 months out of the year in which to do that, January, February, or March. And then your coverage doesn't even begin until July 1st. So you realize now that perhaps you missed the enrollment period that applied to you, so you get pushed into the general enrollment period. It's possible you might have to wait 6, 9 months until this 3 month period of time opens up for you to sign up. And then your coverage really doesn't even start until July 1st. So it's potentially possible that you realize that you didn't sign up on time. You might have to wait a good year before your coverage even begins, which is another significant problem. So, quick review of the enrollment periods. The initial enrollment period is for people that have to sign up by age 65. And so that's if you're going off of your employer sponsored plan, you're retiring, and age 65 applies to you, that's the initial enrollment period. The special enrollment period is for people working past the age of 65 and are covered by a plan with 20 or more employees. And so the best time to sign up then is within the 3 months, 3 to 8 months even prior to your termination. If you do that before the termination, you're going to be fine. The general enrollment period is the place that you don't want to be. I'm going to pause here in just a minute for questions. And so, Terry, I'm giving you a heads up. But the question might also be, how do I sign up for Medicare Parts A and Parts B? Of course, you can go to the internet, www.ssa.gov. That's, of course, the Social Security website, but you can sign up for Medicare benefits there. You can call Social Security at this phone number. That's fine too. Or for general information about eligibility and so on, you can go to the Medicare website, which I have listed there as well. So that's for Parts A and Parts B. As far as how to sign up for Medicare Part D, if you want to go on original Medicare and buy the prescription drug benefit, Part D, or you want to get a Medicare Advantage plan that we talked about, you want to shop both of those, but you can shop Part D and the Medicare Advantage plan by simply going to the Medicare website. And out there, it's really, really useful information. They'll ask you about what doctors you use, what providers you generally stay in. They'll ask you information about you and some of your medical conditions, and it will help you to apply for Part D to narrow that down because there's a number of choices that are out there. And so certainly use that as a resource as well. So Terry, I'm going to stop there and see if we have any questions so far.
Great, thanks, Mark. We do. One of the first is for Medicare Advantage, are there deductibles or just co-pays?
There is a little bit of deductible in there, but that depends on which Medicare Advantage provider you go through. I will say they're pretty minimal, but I would expect the presence of some reasonable deductibles in there, in addition to the copays.
Okay, and the next question we have is, are the premiums pre-tax?
As you pay the premiums for Medicare, Parts A and Parts B, well, Part A is free, but let's look at Part B. So I do believe that that would be pre-tax money. I don't do my own taxes. I have somebody else do them, but I do my father-in-law's. And it did ask for the information about his Part B premium. And so I do believe that that is taken off of your taxable income.
Okay, and if you stay on Medicare plan after you retire, should you stay on the MCW? It's kind of a mixed question here. Do you stay on MCW Medicare plan after you do retire and are enrolled? I think there's kind of a mix here because they're asking also if you should you stay on your employer plan. So I think, you know, if you're actively continuing to work, maybe address that piece of it. And then obviously if you do retire, that changes the dynamics. So maybe address them separately. Pre-retire or
Okay.
once you retire.
Okay, so I might need some help sifting through that, but it sounds like the first question is if you're working at the medical college after the age of 65, is it better to stay on the company plan or to go on Medicare? And my best answer to that is it depends. It depends on your health condition. It depends on how much you might be paying out of pocket within the employer plan. And then to compare that to the cost that you would be paying for Medicare itself. So I ran through some of the premium costs if you're on original Medicare or Medicare Advantage, which those plans are pretty comprehensive. And so if those premiums are less expensive than you might be paying within the medical college plan, then I've told people before it might be best for you to just go on Medicare, and that might be better for you. But again, it depends on your situation, your health, and the costs that you're paying, both in premium, but more so out of pocket while you're going to the doctor. So I think that answered the first part. Can you help me with the other part there, or did I cover it?
I, I think you've covered it. I'm getting kind of mixed questions where I think what they're really trying to figure out is it best to stay on the employer plan if you're still actively working, or once you retire, you know, based on years of service, we do have an option out there for, you know, continued coverage, but you have to have 10 years of service and be a certain age. So that might be what the people are also considering. So let's kind of move along and I'll see if I get other questions that may help clarify too. One of the other pieces is, can you switch from Advantage plan back to the original Medicare or go back and forth?
Yeah. And that's a really good question. I almost get that question every time that I do this. So, and I know the gears are turning there because early on in retirement, you might be going to the doctor a whole lot less as opposed to later in retirement. And that's pretty obvious. So the strategy might be to go on Medicare Advantage and save the premium costs there. But then as you start to go to the doctor more and more, then original Medicare might be necessary. Yes, your premiums will go up at that point, but your coverage would also be more comprehensive. And the answer to the question is, can you move from Medicare Advantage to original Medicare? The answer is yes, you can. And that is something that people have argued with me on, but I've seen people do it. I've had people do it. And so that is available. However, this is a big however. One of the great advantages of Medicare is there is no pre-existing condition that you can be turned down for as you sign up for Medicare. And if you're doing it at the right time, even if you're getting Part D or a supplemental policy or a Medicare Advantage policy that you're all buying through private insurers, they cannot turn you down if you're doing everything the right way. However, if you're moving from Medicare Advantage to go to original Medicare, then there might be some pre-existing conditions that you are going to have to deal with there. But those, it'd be impossible for me to cover those things properly and talk through all of the disadvantages there. So you can save some money on Medicare Advantage with the premiums, especially if you're not going to the doctor all that much. But switching to original Medicare might take some coverage off the table or make it more difficult to apply for those coverages. And so that's the downside and something that you'd want to be aware of. Now, it, if the strategy is moving from Medicare Advantage to original Medicare and back and forth, you don't want to do that. The only strategy you'd want to consider is going on Medicare Advantage early on in retirement and possibly switching to original Medicare later on. But this is definitely not set up to flip back and forth and delay that hip replacement or that knee replacement or pile all of your procedures into an original Medicare year and then go back on Medicare Advantage. This is not set up that way, and I think you're asking for trouble that way.
Okay. Thanks. Thank you. If you're still actively working and decide to go with Medicare, would MCW be secondary? So I think they're getting at who's the payer first and second.
Right. So if you are working, and this might actually be, and Terry, I don't know if this is necessarily your area, but what I encourage people to do is if you're working past the age of 65, here's my recommendation is go and talk to somebody within your human resource department because there are some employers that, yeah, your coverage is still offered to you, but they might want you to go on Medicare Part B and let Part B be the primary policy and their coverage might be secondary or vice versa. So if you're working past the age of 65, I do encourage you to sit down and talk with a human resource person, somebody that's real knowledgeable about the full coverage through the employer, and talk with them about the requirements within the plan itself. And if they're requiring you to add Part B, they're going to let you know if you're paying attention to emails or things they're getting in the mail. But know full well what your employer is either expecting or offering as far as Medicare Part B and how that might work together with your employer policy. So, Terry, do you have any other light to shed on that, perhaps?
Sure. What we typically see, we don't require that people automatically enroll in Part B. Part A is automatic. But what we typically see is people, they're being enrolled in Part A. Part B, we don't require you to take immediately. And we fill out a form that Social Security provides to show you've had that employer coverage during that time period where you didn't take Part B. So then you can show you had no gap in coverage, and then you can enroll when you decide to truly retire and that employer option isn't available anymore. And then you're not paying any penalties as well. So we fill out those forms quite regularly. I don't know if you have anything you want to add, Mark.
Yeah, I did. And
I,
actually,
I,
oh, I'm sorry. I'm two marks here.
Two
Um,
Marks, Mark Lash. I'll
yeah,
let you go first and then Mark Wildeman can join in.
very
we,
good.
we did have a question that did relate to that too, Terry, about if you're working beyond 65. So how does Medicare know that you had coverage? And that's where you'll go to Social Security to apply for Medicare when you do retire, and they'll give you a form that you then send back to MCW that gets filled out where we acknowledge you did have coverage. So as long as you had coverage up to retirement, you don't have to worry about those penalties regardless of the age you retire. But to go back to the initial part of the primary secondary question, so if somebody did actually continue working with MCW, did have our coverage, and also did sign up for Medicare, MCW would maintain that primary position as the primary insurance because we do employ more than 20 employees. So Medicare would be the secondary.
Right, right. Yeah, that was part of, as Mark said, that was part of a longer question. The age 65 and how does Medicare know what you've had or don't have as coverage. So we fill out those forms pretty regularly just to provide that proof of coverage so that you have no gap. They know you've had the coverage, you're not getting applied any penalties. So that's pretty common. During the special enrollment period, can you seek the Medicare Advantage plan only Part D? If so, is the recommended sign up done just before MCW coverage ends? So you did kind of touch on that before. Mark, during your presentation. So I don't know if you want to just reiterate and clarify on that.
Can you, I don't know if this was on my end as you were reading the question, part of it cut out. Would you mind reading it again, please?
Sure. During the special enrollment period, can you seek the Medicare Advantage plan or only Part D? If so, is the recommended sign up done just before MCW coverage ends?
Yeah, so no matter what you do, the recommended period to sign up for the Medicare coverage would be just prior to termination at MCW. So I'll start with that first. As far as the Medicare Advantage, if I'm in your position, let's say it's 10 months before you're retiring, if I've decided already that as I terminate my employment at the medical college, and I want to do a Medicare Advantage plan, I'd be shopping that already. But really, for the 8 months prior to your termination, you can be signing up for that Medicare Advantage plan, which includes the prescription drug coverage. So you wouldn't really be shopping for Part D separate because that would be part of your Medicare Advantage plan. And so then you're shopping for the Medicare Advantage plan that's right for you.
And do some doctors not accept Medicare?
I do think that that is out there. And so certainly you want to be aware of that, but I find it hard for doctors that, unless they have all established patients, that they would be turning many Medicare patients away because obviously if you're over the age of 65, what are you going to do otherwise? So I certainly have heard of that. I don't know how prevalent that is out there, but it all starts then with your doctor. So if I'm talking to you prior to when you need to be signing up for Medicare, it starts with where you live, and that might depend on which county you live in because that drives a number of Medicare policies when you're buying them from private insurance companies. So it's where you live, but then it also is what doctor do you see, and then finding the right policy that your doctor would be a part of.
Okay, and somebody mentioned they heard there are only 3 insurance companies to pick from in southeastern Wisconsin for Part C and D. Can you confirm, and who are they?
And so I don't actually get active I'm licensed in insurance, but I'm a financial advisor that primarily focuses on retirement planning, investment planning. So I don't actually sell the policies. It is true that there are 3 main providers for Southeast Wisconsin. I couldn't even name them offhand because again, I don't quote them or anything, but I will not dispute the 3 main providers because they are specifically suited for those policies, Parts D, the Medicare Advantage, and the supplemental policy. And so if you're going down that road, you're definitely looking at those companies. I believe that Humana is one of them. I'm almost positive. I don't even want to say what I think the other 2 are because I might be wrong, but that's not hard to find out, but good question.
Yeah, I would agree. There's main players that I recall as well, and that we've heard of and worked with people who've retired in the past that mention those same over and over. So that seems to be a common thing.
I also want to say Blue Cross is one of the other 2, as I think through that a little bit, but yeah.
Yeah. If you can switch networks in Medicare Advantage, or do you have to wait until the enrollment period?
No. Well, once you're on Medicare Advantage, you do have to wait for the enrollment period, which would be October into December, and that's when all the commercials come on TV about Medicare and signing up and so on. So initially signing up, you are not affected by that enrollment period. But this brings up an important point. If you're on Medicare Advantage, I strongly encourage you, and it takes some work, but you should shop your Medicare Advantage policy every year. You should shop your Medicare Part D policy every year. If you have a supplemental policy, you should shop it every year. Their coverages change, and there also might be other things that are better for you out there that weren't there before. So once you're on that Medicare strategy, then you really should be researching that in that enrollment period, October to December, every year to make sure that you are in the plan that's best for you.
And can you take the policies with you if you move?
Another good question. And that's where Medicare Advantage can become problematic, because if you're on Medicare Advantage and then you either travel to Florida or you move to Florida, you might have some issues there, because remember, Medicare Advantage works best if you can stay within a healthcare network. But that healthcare network, if you're traveling to Florida or Arizona in the winter, and they don't necessarily have part of your network there, then your Medicare Advantage coverage may not be quite as robust. Or if you're moving from Wisconsin to Florida permanently, you're probably shopping your Medicare Advantage again because you're choosing new doctors and maybe being a part of a new network.
And do you pay more if your adjusted gross income is greater than 85,000?
Yes, if you are a single filer and in retirement, you're on Medicare, if you are making more than $85,000. Now, again, this is for an individual. Then there's a term called IRMA. And what IRMA is it's a means testing of your income in retirement, where your Medicare Part B costs would go up. Your Medicare Part D costs would go up, and there's different levels. So it's only starting once you're over 85,000. If you're a married couple filing a joint return, then that number is around 170,000. Now, this is important because once you're past the age of 72 as well, remember that you're going to have to take money out of your qualified retirement plans, whether you left it at the medical college or you rolled it into an IRA. You might now be getting income that you didn't even want, that starts to push you into levels that make you have to pay more for Medicare. That's an important piece of planning, because there are things that you can do about that ahead of time, but the time to address that is not at age 72. It's much earlier than that, to devise some strategies that controls your income so that you may not necessarily be subject to having to pay more for Medicare, because then that gets to be pretty expensive.
And can you move from a supplement plan to an advantage plan at any time without underwriting, for example, medical questionnaire? And would someone insure you if you had a pre-existing condition?
That's a very specific question, so it depends on the condition, and it's going to be difficult to answer that in a general way. Probably my bigger reaction to that question is, why would you want to go on a supplemental policy, which is a part of original Medicare, that was on the left-hand side of that slide, and switch to Medicare Advantage later? I would think that what you're considering there is, if you're not going to the doctor all that much, you have a supplemental policy, and now you want to switch over to Medicare Advantage. But that means probably a number of years have also gone by in retirement. So is it really the best idea then to switch over to Medicare Advantage at that point? More people start on Medicare Advantage and move back to an original Medicare setup, which would have a supplemental policy, and that's more of the common progression there. But without getting specific, you do run the risk moving back and forth, or at least making one move, because after you're past the age of 65, when you're applying for coverage, whether you're applying for Medicare Advantage later on or a supplemental policy through Original Medicare, you might be subject to some underwriting issues and some pre-existing issues. So you need to be careful with that.
And we do have a couple more questions. I just wanted to, because we are getting towards the end of our time here, if you had additional information in your presentation you wanted to finish. Because
Yeah, so how much time do I have? I see that we're right up against 6 o'clock. So
I mean, we can continue, and as if people need to drop off, I mean, we scheduled it till 6 p.m., but obviously, you know, there are additional questions. Why don't you go ahead and move forward in your presentation, and then we can get to the questions at the end.
I'll tell you what, for people that might need to drop off, maybe bear with me for about 5 to 7 minutes because I'm going to go through a number of things very quickly, but I do encourage you to stick around if you can, and I'll get to the end within 5 to 7 minutes. So hopefully that's fair. There's a slide here that talks about out-of-pocket costs that are paid by Medicare beneficiaries. So first of all, looking at premiums, we've talked about premiums for Part B. Those are paid to the Medicare system. Private insurance premiums for Part D, we've already talked about that goes to a private insurance company, and Medicare Advantage premiums get paid to a private insurance company. Other out-of-pocket costs include deductibles, portion of doctor bills not paid by Medicare, and other services not covered by Medicare because not everything is covered by Medicare itself. As far as the premiums, we've covered a lot of this, so I'm going to move on from this. This slide actually gets to the question that we just talked about, and that is the income-related adjustment amounts, or IRMA. So if you are filing a single return and you're making over this amount, then you can see that your Medicare Part B premium goes from $148 up to $148.50. And then you have an added amount on your Part B premiums. You also have an added amount on your Part D premiums. So if you're filing a single return, but you're in this range here of income and retirement, that pushes your premium all the way up over here. If you're married, filing a joint return, this is the same consequence per person if your modified adjusted gross income is in this range. But you can see it gets much worse here. Maybe this isn't a bad thing, but there is a consequence to it. So if you're making this much money in retirement, you can see that your Medicare costs are going to be considerably higher. So just so you're aware of that. Deductibles, I'm going to just click through these. You can glance at some of the numbers here. So under Part A, if you're going, which again is hospitalization, you have to pay for the first $1,484 as part of your illness. Part B, there is a deductible of $203 per year, but these things are waived if they're in preventative services, and you can see some of the options there. Part D, your prescription drug benefit, does have a deductible as well, $445 a year. So you might say, well, how do we know that if you're buying Part D through a private insurer? And the answer to that is you're buying it through a private insurer, but they are heavily regulated and mandated to include some of these issues as part of their policies. So they're not just designing those policies from scratch, they're actually staying within the guidelines of the Medicare system itself. Coinsurance. So again, even though you're past the deductible, you've got the following coinsurance issues. Now, this is where I'll also mention, if you buy Part B and Part D and a supplemental policy, a good supplemental policy picks up a lot of this stuff in here, which then shows you the need for the supplemental policy in retirement. Okay, we talked about Part D as well, and here's the coinsurance. There's different levels here, more than we can really cover during the presentation, but so you're aware what some of these levels are with other coinsurance issues there. What does Medicare actually cover? Well, hospitalization. It does cover 100% of the first 60 days. Medical services, you can see there. Now, here's where I strongly encourage you to do this one thing. Get the Medicare in You booklet. This is, frankly, one of the best government issued pieces or document that gives so much valuable information about the coverage of Medicare and a lot of the stuff that we talked about. How do you get this? Call this number or go to the Medicare website, but get the Medicare in You booklet. Extremely helpful to know what Medicare covers and doesn't cover. But, and as a general rule, some of the things that Medicare does not cover, doesn't cover long-term care. If you go outside the United States, you're not going to be able to get reimbursed for Medicare if you're getting health care outside of there. It doesn't help, or Medicare does not cover dental care, vision care, although supplemental policies, more and more of them are picking up vision care and dental care. More and more Medicare Advantage policies are picking this up as well, and so something to be aware of. Doesn't pick up hearing aids, cosmetic surgery, acupuncture, amounts over the Medicare approved amount, and amounts not covered by deductibles and coinsurance. Okay, then you certainly know about the private insurance that you buy and what things those policies are going to cover or maybe don't cover. Also with your Medicare supplement policies, know exactly of what's in there. There are a lot of laws that regulate these supplemental policies, and it's definitely things that they have to put in there that you can read through on your own. Medicare, Medigap, again, those are the supplemental policies. So you would not have a Medigap or a supplemental policy and Medicare Advantage. It's one or the other. And so that's how that works. Medicare Advantage plans. So all sorts of things here that we've talked about already. Most of this we've talked about and covered as well. Shop carefully for private insurance. Very, very important about your drug plans, your Medicare Advantage plans, your supplemental policies. Know what's in there and know what is the best policy for you, and use the Medicare website to help you to shop for these things. They've done an excellent job of comparing what's out there and what might be best for you. So, final word on healthcare costs in retirement as we wrap this up. First of all, there's a number of things that can actually affect your healthcare budget and so on. So be careful when you are considering all of this as you put it together. What types of things with your prescription drugs might not be covered or have a lot of gaps in your Part D coverage, and so know what's going on there. Know what's going on with your dental and vision, hearing, and other things as well. Fidelity put out a research not too long ago, and they're basically saying that for couples having $295,000 earmarked at the beginning of retirement is about what you're going to need. You'll need to have this much at the start of retirement to pay for future Medicare or medical costs, but this doesn't include long-term care. So if you have $500,000 saved in your retirement accounts, realize that actually $295,000 of that is probably going to go to healthcare. Obviously, this is one of the most important pieces of your retirement future. We're going to skip through long-term care. So finally, 3 reminders. Number 1, did I make it clear that it's important to enroll in Medicare on time? Make sure that you know when you need to enroll. If you have any doubts whatsoever, contact me. I will help you to figure that out. This is one of the most important things to execute in your retirement is enrolling in Medicare on time. Number 2, shop carefully for private insurance to go with Medicare. That's your Part D, your supplemental, or your Medicare Advantage plans. And number 3, plan for higher healthcare costs in retirement. Healthcare and long-term care are the biggest threats to people's retirement. So In the midst of all this, this can be quite overwhelming. And I mentioned at the beginning that you might want to consider an individual consultation, which I'd be happy to do. Number one, I do not sell anything in that consultation. Let me show you quickly what we do in that meeting. This can be done virtually or it can be done in person. Number one is I ask you in the meeting, what questions do you have from this presentation? Number two, I gather some information for you because I put together a complimentary medical costs estimate for you in retirement. So you have an idea as to what all of this is going to cost specific to your situation in retirement. Then I put a report together and I present that to you and we go through that report. And then I simply stop at that point and I ask you, is there anything else I can help you with? A number of people say, no, this has been really helpful. You've answered some questions. You gave me my report. I'm good. And then I basically say, thank you so much for coming in. Some people have a lot of other questions about retirement planning, might be investment related, might be tax related. I do a lot of Social Security consulting as well, along with a number of other things, and we get into other conversations. But that's up to you. You drive whether you want to talk about those things or not. And then at the very end, I just say, thank you. Now, if you're interested in that type of thing, and we'll get to more questions right after this, but here's my contact information. This phone number is my direct office number. Some people just call up with some questions. I'm happy to deal with some of those questions if you just want to give me a call, or you can email me at this address. Or a convenient way, if you want to set up a consultation, go to this web link and it has my calendar out there where it shows you some available times. You can just simply sign up for an available time. It'll give you an option as to whether you want it done virtually over a Zoom call or whether you want to come and see me. And I have my address here in Waukesha. I'll get you for further directions if you'd like. But if you'd like to come and see me and have an individual consultation, get the healthcare analysis report that I can do for you, here's the ways that you can sign up for that. So I am done then, Terry. If there's other questions, we can cover those. And if you have to drop off, I want to thank everybody for participating tonight. Hopefully you got a little bit more helpful information in order to be successful in making your healthcare and Medicare decisions in retirement.
Thanks, Mark. There's lots of decisions, right, when it comes to this topic, for sure. So we do have a couple more questions. I just want to let everybody know, I will send the slides out to all of you once we're done with the presentation, probably first thing tomorrow. So I'll get those slides to you so you have them as reference. Mark did provide those to us, which is wonderful. And another question we had, which I'm going to answer, somebody asked more about long-term care. I wanted to let you know we have another session coming up on Tuesday on estate planning. So Tuesday, May 18th from 5 to 6 p.m. That's our next session. But we are also offering a session about long-term care on Thursday, May 27th from noon to 1. If you're interested in that, you can sign up through the wellness events calendar. And that session might get a little bit more into the long-term care aspects that you were asking about. One of the questions that we did have was when do you collect your first Social Security check if you retire at age 62? And I know you do a lot, Mark, on Social Security, so you may be able to answer that.
Yeah, so many people know that at age 62, you are eligible to start receiving a Social Security paycheck. So there's really three ages that are important when it comes to Social Security. There's age 62, the earliest that you can start drawing. There's your full retirement age, which for many people now is getting to be age 67. You might be old enough where it could be before age 67, but the earliest your full retirement age would be is age 66. But then you can also delay your benefit all the way out to age 70, which maximizes your benefit itself. Now, the drawback to drawing at age 62 is you'll take about a 25% reduction in your benefit, which lasts for your lifetime, if you draw at age 62. So I would encourage you that if you're going to draw at age 62, there better be a pretty good reason. And if you're still working past the age of 62, you might not even receive that benefit fully because you might be making too much money. After your full retirement age, you can make as much money as you want and then draw your full Social Security benefit. But be careful if you're working and wanting to draw a Social Security benefit before your full retirement age, because you might be getting an even further reduced benefit. Now, if you're delaying that taking of Social Security until age 70, each year you delay it past your full retirement age, commonly about age 67, you're getting 8% guaranteed bumps on your benefit by waiting as well. So there's a big variance in there between what you'd be eligible for at age 62 and also what you'd be eligible for at age 70, and then everything else in between. And oh, by the way, if you're married, that's not just a decision for you, because depending on when you started your benefit, that might also influence how much money your spouse gets after you're gone. So delaying your benefit can also provide some more assistance for your surviving spouse after you're gone. So how you make that decision, that all depends on your overall situation, whether you're going to work past 62, how much money you might need to live on, what else you want to do in retirement, and what your other resources are. And that takes some further planning itself there too, which can be a bit complicated. That's something I help a lot of people with as well, in order to sift through all that and find the best strategy for you.
Great. And if you sign up for the 8 month, 8 months early, do you pay the premium for the months that you are actively working, or does the premium kick in once you actually retire?
It kicks in once your coverage starts. So you are not having to pay for extra months, because you're getting coverage through the employer yet.
And then we do have a question: would the MCW premium be less if Part B, as in boy, is primary? And typically I can say what we see with that is, if you're still actively working, MCW is always going to be primary. So when you do fully retire, then obviously Part B would become the primary. I don't know if you have anything to add there.
What I would say with that is, no, it wouldn't reduce your employer premium at all. What it does for you is maybe some of the deductibles or co-pays and so on that you have within the MCW plan might be picked up by Medicare. So that's where your advantage really is there, because if it's secondary in coverage, it's essentially becoming a supplemental policy to the MCW plan, in which case your real benefit is you might have more stuff completely paid for, and that's why you might want to consider then having that Part B.
Okay. And the last item that I have is, as a provider, what does MCW offer as a benefit to employees who retire after greater than 10 years of employment? And Mark Lash, I'm going to ask if you can join on with this one. We have information on our website, and I cannot remember if it's on the retirement or on the benefit side, but we have information on out there what the age brackets are and the years of service. And Mark, do you recall where that is on InfoScope?
I don't for sure. It is on the benefit site, but if you go to the search box, you should be able to just type in retiree benefits, and it'll bring up the chart. You should find that in the search results to get to that chart where it shows it's based on, but the coverage, regardless, as long as you have enough years here, depending on how long you've been here, whether it's 10 years or 20 years, you can extend your insurance here for a longer period of time, but it automatically ends at age 65 when you become Medicare eligible. So if you're 62 already, if you've been here 10 years, I believe that's more than 3 years of coverage. You're only going to get 3 years worth. Because once you turn 65, you're no longer an employee. You have to drop off our insurance and take the Medicare.
Yeah. Agreed. I just couldn't remember where it was on the website. We've been working on a lot of website updates. The other thing, if you go to the retirement website, there's some really great information out there. Some helpful, resources that can walk you through different questions you might have. Mark gave you his contact information here. How to reach out to him if you're interested in meeting with him. We also have him. We take referrals from employees on financial advisors and planners that they work with. And how do I find one? That's a common question that we get quite often. And Mark Wildeman's name was actually referred to us by someone. So his name is out on the website. So if you're looking for that, his information is out there as well. I think we've covered all the questions that I saw. Mark Lash, did you see any other ones? Did I miss any?
I saw one additional one. So I don't know if you want to go into this, Mark. I thought this was something that was actually kind of being closed. The gap was being closed, but the question was, can you explain the donuts? I believe that, talking about the donut hole.
Yeah. Basically, when you have, if you're on original Medicare, so you have Part A, Part B, Part D, there's a number of things that happen there where coverage is there up to a certain amount, and then it shuts off where you're on your own, and then it might even get to another level where the coverage picks up again. And so that donut hole in there is the part where you generally don't want to be, because even though you've got coverage at the beginning and maybe later on, while you're in the donut hole, you're paying for everything out of pocket. And that's where the gaps come in. That's where the donut hole comes in. But the supplemental policies help to kind of fill those gaps then, so that you don't have all of that stuff going on. And that's where they're specifically designed to fill those things. And that's why they're supplemental policies, is what I normally call them. But they're also called Medigap policies. They're designed to fill the gaps that Medicare has.
Great. Good information. Thanks for gathering that question. I think we've covered everything. If you have additional questions, obviously you can email Mark Wildeman directly. You can also email us at the retirement email box, and we can help you with those at the wellness email box as well. We're happy to help you with any of those other questions you have. We appreciate your time this afternoon, and thank you for attending, and I will send out the slides first thing tomorrow morning to everyone. So have a great evening, and thanks for joining us this afternoon.
Thanks, everybody. Appreciate the opportunity.